Hello, my name is Niall Bourke. I am a postdoctoral researcher at Imperial College London under the supervision of Professor David Sharp. I am presenting work done during my PhD examining the effects of focal lesions on cognition following traumatic brain injury. Phineas Gage is the quintessential case study of traumatic brain injury, characterizing the effects of frontal lobe damage. Symptoms of frontal lobe damage include dysexecutive behavior, disinhibition, and mood disturbance. These symptoms can have profound implications on rehabilitation engagement, personal relationships, and reintegration into work. Expanding on this well-characterized case study, we examined 102 patients presenting with focal lesions resulting from traumatic brain injury. As can be seen from the overlap map, the burden of injury is concentrated in the frontal lobes and temporal poles. Voxel-based lesion symptom mapping was performed using the non-parametric mapping toolbox to investigate cognitive measures typically ascribed as being frontal in nature to the likelihood of lesioned voxels. These measures included the Frontal Systems Behavioral Rating Scale, the Trail-Making Task, and the DKEF-Stroop. The results showed that presence of focal lesions are associated with higher symptom scores, greater than 1.5 standard deviations, and spatial variability was seen across each of these measures. Overall, these results support the association of frontal lobe injuries and executive dysfunction. However, many TBI patients presenting with moderate severe injuries classified by the Mayo system do not have penetrating or focal injuries, yet have ongoing cognitive difficulties. A group of 42 moderate severe patients without focal lesions were compared to the lesion group on these cognitive measures. As can be seen here in the table, no significant difference was seen between the lesion and non-lesion brain injury groups. Cause of injury can vary, such as road traffic accidents, falls, or sports-related injuries, and mechanisms other than focal injuries may contribute to similar behavioral presentations. Diffusion tensor imaging is a method to assess the white matter structural connections in the brain. In the absence of focal lesions, subtle damage to the white matter tracts may arise as a result of shearing forces from acceleration-deacceleration type injuries. Widespread impact to the white matter tracts are seen in both the lesion and non-lesion TBI groups compared to controls, as seen in the top two panels here. The bottom row shows the contrast between lesion and non-lesion patients. Other than a section of the genu of the corpus callosum, no differences are seen between these patient groups. Calculating the effect size difference compared to controls, we can see large differences across a number of white matter tracts. As with the behavioral results, these effects are similar for patients with and without focal lesions. To further understand the impact of lesions on network dysfunction, an exploratory analysis was conducted to identify white matter pathways that may be disconnected to distal brain regions as a result of injury. This is important on two fronts. One, it maps out structural connections to distal brain regions which may be impacted following a focal lesion. And two, it highlights white matter pathways, if damaged in the absence of focal lesions, may lead to similar behavioral phenotypes. Tracts most likely disconnected due to frontal focal lesions are the corona radiata, genu of the corpus callosum, and the inferior orbitofrontal fasciculus. Expanding on this work, masked independent component analysis was performed using the high probability lesion overlap as a seed region, projecting onto 100 independent resting state scans from the Human Connectome project to identify functional networks that may be impacted. 12 components were derived. Some of these components reflected functional networks such as the default mode network and frontoparietal network. Structural damage to the medial prefrontal cortex removes a node in these functional networks and would necessitate functional reorganization, which is a topic for further investigation.